Breastfeeding did not work out with her first. She felt like this was her last chance to get it and do it right. And everything was falling apart again. She found herself exclusively pumping and bottle feeding, and she was heartbroken and frustrated and angry. Hey, Mama Bear. Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jamie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in. Hey, howdy, hey, Mama Bear. Welcome back to the Breastfeeding with Confidence podcast. Today, we are going to start a series on navigating tongue tie in your newborn. We'll be answering questions like, what is a tongue tie? Do tongue ties impact breastfeeding? And how do you treat a tongue tie in newborns? Before we get started, though, you should know how important it is to me to make sure that this podcast is serving you at the highest level, meaning your questions are being answered. I've just added this super cool feature to my podcast where you can actually submit your breastfeeding questions via voice message to be featured on a future episode. So whether you're pregnant, navigating difficulty latching, or having milk supply issues, visit littlebearlactation.com/breastfeeding-podcast. The link is also in the show notes, and submit your breastfeeding questions to be answered. All right, let's get started. As a lot of you might know, I really struggled with tongue tie with my oldest baby, but all 5 of my babies actually had tongue ties. So, tongue ties are actually very, very, very important to me. And it's a topic that really hits home for me. There's a lot of controversy about tongue ties, there's a lot of confusion about tongue ties. And there's a lot of really mixed information out there. And it can be really hard to know if you're doing the right thing. And it can actually just be really hard to know if your baby even has a tongue tie. Is that something that you should be considering or thinking about or worrying about? So, I want to kind of start this series off today with just a broad overview of what is tongue tie. Um, Talk about maybe a couple myths about tongue tie that I hear passed around a lot, and let you know about some of the episodes that are coming up so that we can deep dive into different topics about breastfeeding with tongue tie. So, first, I want to share a story about a client that I worked with. I was considering sharing my story with you, but I don't just want to talk about me. I want to talk about other real moms. And the mom that I am talking about today has a very, very common story, which is why I think it is such an important story to share. So, I am changing her name for privacy. We are going to call her Caitlin for the purpose of this podcast, just to protect her privacy. And I'm not going to share, a whole lot of super private details, but I'm going to share the broad, common scenario that a lot of moms find themselves in. So when Caitlin reached out to me, she was a few weeks into breastfeeding and it was hard, and she really wanted breastfeeding to work. It was really important to her. This was her second baby. Breastfeeding did not work out with her first. She felt like this was her last chance to get it and do it right. And everything was falling apart again. She found herself exclusively pumping and bottle feeding, and she was heartbroken and frustrated and angry. Her baby was having trouble staying latched. When he was latching, he was falling asleep at the breast. She wasn't able to get a full feed in him. He was very upset, very cranky. He had a lot of reflux issues. It was, just everything that so many moms are dealing with that you hear about, they were dealing with it. She was frustrated. And so she told me he had a tongue tie, but we went and had it clipped at the ENT and it didn't get better. In fact, it actually got worse. And she felt very helpless and confused. And she was like, I don't know what to do next, but I need this to work. I really need this to work. I really am invested in this. I want this to work. This is important to me, but I don't know what to do. I can't make it work. So she was actually a virtual client, which is one of the reasons this story is my favorite, because it highlights how much good work we can do virtually. And it also highlights how when moms get their hands in there and are starting to like feel in their baby's mouth, they get to understand firsthand. They're the ones doing the examinations. I'm walking them through the examinations, but they're doing it. So they're my eyes, they're my ears, they're my fingers, and they can see and feel and start to understand exactly why their baby is struggling. So she followed my directions to do an oral function exam virtually. And what we found was that the baby was still having difficulty with extension and elevation and cupping. And in fact, he was even struggling to stimulate that suck reflex. Upon further evaluation, what we determined was that the release that she had done with the ENT, it was like a scissor ENT release. The release that she had done initially was an incomplete release. So it did not address the posterior portion of the restriction. It actually, they did not do the lip, and there was tension in the lip as well. And basically, what they had done was what I call a cut and go procedure where they didn't have any prep work for it. They didn't do a proper oral function evaluation. They did not make sure that this baby was ready for release. And they did not have any follow up. They were told that it was not necessary to do any exercises, any elevations. There was nothing you had to do afterward. They were told that just breastfeeding would be enough to make the tongue move the way it's supposed to. When providers tell parents that, I find it really frustrating because we kind of have this combination of, oh, the provider was listening to us. They acknowledged the tongue tie. They they found this tongue tie. They admitted it exists and they treated it. So they're helpful and they're trying. But that's like me trying to tell my husband what's wrong with my car, honestly. Um, I could be helpful. I can be trying, but I don't actually know what I'm doing. I don't know what I'm talking about, and I can make things worse if I'm trying to have the solution without getting a full diagnostic of the problem. And that is not to say that lactation consultants diagnose, but not all ENTs or dentists who perform tongue tie releases are trained, experienced, and qualified to diagnose either, or even treat them, if I'm being completely honest. So I don't want to get too into the weeds on this right now. I just want you to know that what ended up happening with her is we broke it down to identify her baby's very specific deficiencies. Okay. So, like, not just, oh, he has a tongue tie and he's having trouble latching, but which part of the latch is not working. And then we started working on those. We worked on getting a nipple shield. She was so dedicated. She used a nipple shield and an SNS, and they hated that thing. They hated that SNS. Um, but it was a tool that we used for a little while, and then we got off of it. But it eliminated some of the triple feeding she was doing. It eliminated, a couple steps when she was really having trouble finding balance, and it taught him how to feed at the breast. He learned how to nurse at the breast. We improved his skills. We improved his ability to transfer. Once he was ready for release, we got a secondary release performed. Some people will call that a revision. The first release, since it wasn't even a full proper release, I just don't even consider it a release. Anyway, we had a second procedure done where they addressed the lip and the tongue, and we did the proper aftercare. We stuck with it. We acknowledged that this is not a cut and go thing. This is a process. There are steps we need to take to be ready for this process. There are steps we need to take afterward to make this process actually work. And just a couple months ago, I did a weaning consult for them. We got them set up on weaning because she made it to her year of breastfeeding. She made it to her goal. She dropped the unnecessary bottles. She dropped the constant pumping. She didn't need the SNS anymore. Her baby was exclusively breastfed at the breast for months, even though they had a really rough start. Even though they were dealing with so many challenges in the beginning, they got there. And that's what I want you to know is you can get there. So what is infant tongue tie? If you are listening to this episode and already know what tongue tie is, you're probably sitting here like, But maybe you are like, okay, but what is a tongue tie? I've heard that. I've heard that phrase before. I've heard people talking about it causing latching issues, but what is it? So the official word for tongue tie is ankylosing. So you might hear it referred to as ankylosing. But a tongue tie is essentially restriction of the lingual frenulum and it affects tongue movement. So if you lift your tongue up, there's a point where the tongue basically connects to the floor of the mouth. For some people, the tissue that connects the tongue to the floor of the mouth is short, it is thick, it is very tense. Maybe it is too far forward, and so the whole tongue can't lift. Um, there's different variations of what a tongue tie looks like, but at the end of the day, it's basically like extra skin that is holding the tongue in place, not allowing it to have the full range of motion necessary for functional breastfeeding, for functional feeding of any kind, for optimal breathing, even. Sometimes I might describe it as extra webbing between fingers. You know, if you had webbing between your first and second finger, you probably wouldn't be able to move them as much as you do. There would be challenges, extra challenges that you would face. It's the same as the tongue. You're going to hear people talk about, is it a severe tongue tie, a bad tongue tie, a mild tongue tie? What class is it? Honestly, we'll dive into that more when we talk about symptoms and everything, but it doesn't really matter what it looks like because there's a misconception that a tongue tie is identified based on how it looks versus based on how the tongue is functioning. A lot of times, tongue ties are missed at birth. A lot of times, doctors will say there is no tongue tie. A lot of times, lactation consultants will say there is no tongue tie. A lot of times, a lot of people will say there is no tongue tie when there is. And then that tends to leave moms feeling very broken, helpless, and confused because they know something's wrong, but everybody's telling them, well, this isn't wrong, and I don't know what is, so you probably are just not made for this. And that's not true. That narrative needs to stop, and that's why we're doing this series. So, tongue tie really is extremely controversial, and I am going to do my very best to clear up a lot of the questions you have over the next few episodes. I am going to break this into series so that you can start getting answers to your questions about breastfeeding tongue-tied babies. But today I wanted to talk about a few misconceptions that I hear running rampant about tongue tie. And I just want you to start here in case you have heard some of these and you're suspecting tongue tie. It might be part of what you're dealing with. This might help clear things up a little bit. So, one, you might have heard that tongue tie doesn't impact breastfeeding. The truth is, tongue tie absolutely does have the potential to impact breastfeeding. And as I said before, it doesn't matter what the tongue looks like, it matters how it works. An interesting example of this is I actually had a tongue tie when I was a baby. And my parents didn't really know that I had a tongue tie. And my mom said that I breastfed fine. I breastfed for 3 months. The only reason she stopped breastfeeding me was because she had to return to work. So she just thought it made sense to switch to formula. That's the only reason that she stopped breastfeeding me. The tongue tie did not impact breastfeeding for her with me. The funny thing about that is I actually had my tongue tie released when I was 4 because my parents said that I could not lick an ice cream cone, and every time I tried to lick an ice cream cone, it would just smear all over my face. And I have seen pictures of me before my tongue tie was released where I was trying to stick out my tongue and actually looked like a snake's forked tongue, but it didn't impact breastfeeding. Now, could there have been a lot of compensations in place? Absolutely. We don't fully know that because there wasn't so much understood about it back then. There likely were compensations in place. Maybe if she hadn't switched to formula, her supply would have taken a hit and I would have, we see that a lot around the 3 to 4 month mark. The supply takes a hit because the tongue actually isn't working as well as we thought it was. The mom's body is just compensating. But it's really interesting to see that with me, she had no pain and I had a very obvious tongue tie, even though they didn't really know about it at first. With my siblings, she stopped breastfeeding them very early. With my sister, it hurt way too bad. She was in so much pain. And with my brother, he wasn't getting enough milk to clear his jaundice. He was simply not transferring milk. He couldn't transfer milk. And again, they didn't know that tongue tie was the reason. They didn't know how to examine oral function. They just were like, you need to stop trying to breastfeed because it's not working. Looking back, we can see that this is likely a huge factor in why my siblings had such difficulty breastfeeding, but they didn't have as obvious as a tongue tie as I did visually. Functionally, however, it was there. So when people say tongue tie doesn't impact breastfeeding, um, that's a very narrow point of view and it's a very uneducated point of view. Other people will say tongue tie only impacts breastfeeding and therefore bottle feeding solves the problem. And this is another major misconception that I see issues with. Again, my own story for this one is that my son had a tongue tie and I was in a lot of pain. And so my doctors and the lactation consultants just basically kept saying, well, just bottle feed, just bottle feed, just bottle feed, just bottle feed. Guess what? He couldn't bottle feed either. When we would try to bottle feed him, he would actually flip the nipple, like invert the nipple, because he wasn't using his tongue properly. He could not feed off that bottle for anything. The only way he was getting any milk was to nurse, and I was in excruciating pain. So, bottle feeding does not always solve the problem. And even if they are able to compensate at the bottle and effectively get milk, it's still not solving the root cause, which can go on to have impacts down the road, which we will talk about in another episode. And then a lot of people say that tongue tie isn't a problem if baby is gaining weight well. So, what I hear a lot is I hear moms say, like, oh, I'm dealing with mastitis and clogged ducts all the time. My baby has a tongue tie, but I don't have any pain and he's gaining weight well, so there's no problem. Usually, this is when the baby's about, 3, 4 weeks old, maybe even 6 weeks old. And we do an oral function exam, and it's like this baby is not nursing well at all. They're opening their mouth and catching the milk. Mom's body is working overtime. She's making more than enough milk right now for one reason or another. Baby is coasting, we call it coasting off the letdown. They're just opening their mouth. They're doing no work for this milk. They're getting it. They're not telling the body to get any more milk out. So they're not fully draining the breast. And then mom is having issues with mastitis, clogged ducts. And next thing you know, her supply tanks because her supply starts to regulate and her baby doesn't know how to demand more milk because he never learned how to actually use his tongue to feed versus just catching what's coming automatically. And now that the milk supply is regulated and he needs to be putting that demand on the body, he needs to be sending those signals and messages to the mom's body. He's not. He's not getting enough milk out. All of a sudden, his weight gain goes down. Mom's supply goes down. And it seems like everything's just falling apart and nobody knows why. Tongue tie. Tongue tie. It is a classic story. So it is not always true that if your baby's gaining well and you're not in pain, that tongue tie isn't a problem. A lot of times there are still compensations at play. There are still immediate consequences. There could be consequences down the road. And tongue tie really does have lifelong impacts, like I said before. So in the upcoming episodes, we are going to discuss symptoms of tongue tie in breastfed newborns, who to turn to if you think your baby has a tongue tie, and we're going to talk about tongue tie treatment options for babies. If you do have any questions about tongue tie that you want featured on the show or any other breastfeeding questions you'd like to have featured, go ahead and visit my website, littlebearlactation.com/breastfeeding-podcast, or go into the show notes and you'll be able to submit your question via voice message there to have it featured on the show. If you are pregnant and ready to take action and learn how to get a great latch from the start, be sure to register for the free Secrets to a First Latch Without Pain course at littlebearlactation.com/secrets, where we will bust breastfeeding myths. You'll learn how to make a breastfeeding plan, and you'll learn my go-to latch technique for a great first latch. Additionally, if you join Latching with Confidence right now, you will not only learn how to get back to the basics and use your baby's design and reflexes to get a good latch, you'll actually get access to my Breastfeeding Your Tongue-Tied Baby guide that walks you through everything you need to know about navigating breastfeeding with a tongue-tied baby. So if you're like, I don't have time to wait for the rest of these episodes to come out, go ahead and hop into Latching with Confidence at littlebearlactation.com/latchingwithconfidence, and you can get a head start on getting your questions answered. I can't wait to dive into symptoms of tongue tie in breastfed newborns with you next time. All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.